All right, good morning, everyone. Sorry, this is a little bit earlier than it was on my notification, but if you're planning on watching it live, good news, you can watch it at 9 a.m. just as promised. So today we're going to be talking about vitamins and supplements for vestibular conditions. Most of them that are researched is typically vestibular migraine, but not always. Remember, this is not medical advice. I am not your doctor. Don't necessarily take advice from someone you find on the internet. I did do a little bit of research, but again, always ask your doctor about taking any of these medications, supplements, vitamins, anything like that before you actually go and do it, because some can have interactions with others, and it's important to make sure that you're not taking anything that's unsafe for you. So as always, this is not medical advice. All right, so there has been a lot of research to show that different supplements and vitamins can be really helpful for treating vestibular disorders, both acutely and prophylactically. The biggest one is vestibular migraine. So we are going to start there. There are a couple big ones. There are magnesium, riboflavin, or B2, CoQ10, which is a coenzyme, sometimes Feverfew, depends on the person, and then vitamin D are all big ones. So let's start with magnesium. Most people can take up to 400 up to 800 sometimes. Remember, it depends on your needs specifically, so ask your doctor what you need. But that's kind of a preventative dose. And typically oxide is recommended. However, that can give people some stomach issues. So some people do get diarrhea, just to be blunt about it, from magnesium oxide. So some people tolerate magnesium glycinate better. There are pros and cons to both. And then a lot of people, I'm sure you know, maybe you don't know this, but I just found out that some people really swear by magnesium threonate as well as glycinate. So taking the both, and they say that the magnesium threonate, which is commonly called Cognimag by Pure Supplements. It's on back order still, I think, but that is, people swear by it for brain fog like they would a cup of coffee. So especially if you are sensitive to coffee and caffeine, which we'll talk a little bit about in a minute, that could be a good one for you. So the reason magnesium is effective is because there is typically a decrease in magnesium in people with migraine. So specifically, there's a deficiency for whatever reason in people with migraine and vestibular migraine. And so that's just part of migraine pathology. If you have too little magnesium, then you're more likely to get a migraine. There is very little research about why all of this works, but we know that it does. It promotes less cortical spreading depression. So if we think about the mechanics of how a migraine occurs, you think about it as a cortical spreading depression, which is the fancy word for a really high series of activity followed by a really low drop in activity, which stimulates the trigeminal nerve and causes the migraine attack. And people who have enough magnesium don't have that as frequently, so that's why magnesium is one of the big ones that people with migraine take. Next big one we can talk about is B2 or riboflavin. And so it's about 400 milligrams a day, but it really is dependent on you. Again, some studies have less, some studies have more, but a 2004 study, and I can send any of these studies to you if you want to see them. I'm not going to link them, but they do exist. So 2004 study found that people who took riboflavin for 3 months had a decrease in migraine days by half. So from the people who had 4 migraine days a week, they had 2 migraine days a week, which is great. And that difference is always good to see because everyone wants a decrease in migraine days. It's safe, it's well tolerated, there's no side effects for the most part, and it's something that's naturally occurring in our body. So we make B2, but clearly we don't have enough B2 that we need to supplement it. You can also find all these things in foods, and on the link in my bio, you can find places to find it in foods if you don't want to supplement it, but it can be easier, especially if you have sensitivities to food, because a lot of the foods that have these things in them are also foods that people are sensitive to with migraine. So good to think about. The next one, coenzyme Q10 or CoQ10 for short. There are a couple studies that I found. The first, they did 150 milligrams daily for 3 months. People experienced a reduction without side effects of their migraine, which is great. And then in another study about CoQ10, 100 milligrams per 3 times a day. So it's 300 milligrams throughout your day, but you're taking it like breakfast, lunch, and dinner. Was 3 times more effective in reducing migraine than the placebo group was. So you can tell between the placebo group and the non-placebo group that there actually is a difference there, not just because you might think you're taking something. So there really is a difference with CoQ10. The dosage can really vary. It depends on you again. Ask your doctor what is right for you. It is an enzyme. Enzymes are great, or a coenzyme, so it helps with different reactions in your body. So Feverfew, people really say is a hit or miss. Do be careful if you're taking Feverfew because the PA in it can be unsafe, especially if you're pregnant. Most of these supplements you can take if you're pregnant, which is when a lot of people get vestibular migraine the first time. So always be sure to ask your doctor first what you're getting, but what you're taking, but Feverfew typically isn't as safe for people in pregnancy, so do know that, especially if it has PA in it. So always be looking for PA-free Feverfew. Oh, that Butterbur has PA. Sorry about that. So regardless, Feverfew, people either unchanged or only mildly effective for most people. For symptoms of nausea and vomiting only, but not necessarily the vestibular symptoms. So Feverfew doesn't really help the dizziness and vertigo imbalance feelings or a migraine attack. It just helps with the nausea and vomiting. So that's good to be aware of, that it's not super helpful for that, especially since the diagnostic criteria in vestibular migraine does not include nausea and vomiting. But I think the regular classic migraine, you can have nausea as a criteria. So that is good to be aware of. So next one I'm going to talk about is vitamin D, typically D3. There is research to show that 42% of people with vestibular migraine have a vitamin D deficiency, which is a very large percentage. So supplementing vitamin D and or getting outside can be really helpful. However, because getting outside, we usually have clothes on, you usually don't get enough vitamin D just by going for a 10-minute walk. So for most people, especially if you don't live in a super sunny place like Florida or something, California, if you don't live in one of those places where you're always outside getting enough vitamin D, you're probably vitamin D deficient. This helps with bone health. It can help with actually preventing BPPV, vestibular migraine, all those things. So it's really good to supplement that. Be sure to ask your doctor, of course, to make sure it's not interacting with anything else you're taking. But that is why it is good. So that it also helps vestibular neuritis, Meniere's disease, and BPPV. So including vestibular migraine. So basically, if you have a vestibular disorder, if you're a human being, really, you should be taking vitamin D. Because the reason it helps BPPV, I want to go into that a little bit, is because of bone density. So the ear crystals or otoconia that are in your inner ear are made up of the same calcium structure as your regular bones. So if you think about getting osteoporosis or osteopenia, which is the precursor to osteoporosis, as you age, you can think about it kind of disintegrating in your ears as well. So bone structure is helped by both calcium and vitamin D. We don't make or absorb any more calcium after the age of 30. So if you're over 30, you're either sustaining or decreasing the amount of calcium in your body. So it's really, really important to make sure you're having enough calcium throughout your day, whether that's from vegetables or dairy products, or through a calcium supplement. So that's why it's important to take that, because if you're chronically getting BPPV, it could be because of osteoporosis, and you can always request a bone scan to see about the bones in the rest of your body to see if maybe your otoconia have the same problem. You won't be able to see your otoconia on that scan. It's just not specific enough, but you will be able to see obviously the rest of your bones. So good to know on that. As far as the rest of the vestibular migraine supplements go, there's 2 more that I wanted to touch on. Omega-3s, and we already talked about those a little bit on a post this week. That's the one that is in fatty fish and avocado and walnuts and things like that. again, this can be stuff that you're sensitive to. If you have vestibular migraine, it could be a trigger food for you. You could be avoiding these things for a short-term or a long-term period. So that's when it can be good to buy fish oil at the store and supplement with it. So people who found in this new research study came out this year that diets that are high or supplemented with omega-3s without changing the amount of omega-6, which is the other less healthy form of omega, then those people, without changing that, remember, they just supplemented the 3, is protective against migraine. So that is because the trigeminal nerve, which is your nerve that goes right here, so it's the one that's stimulated in a migraine. You have a branch here, and a branch down here. Though that nerve can be sensitized by omega-6. So that means that you increase pain. And when you take omega-3s, that helps provide nociceptive properties or reduce pain in that nerve. Lastly, more new research about melatonin. Some people say this makes them too sleepy, even if they take it at night in a really low dose and they don't want to take it. That's fine. This is just informational. This says that low-dose melatonin, so just 3 milligrams a day, you could take it at bedtime to help you sleep if you have difficulty sleeping, that it is more effective than placebo, so better than not taking anything, and more tolerable than amitriptyline, which is a common medication that people take with migraine. So it's more tolerable and as effective as amitriptyline in this study. So people who took melatonin had the same outcome as people who took amitriptyline, and it was more tolerable. So that's really good research because melatonin is something that we already promote or produce in our body. It helps with our circadian rhythm, which is kind of this slow sine wave kind of rhythm that our body goes through every day. It helps with sleep and wake cycles and other things to produce hormones. So that's really good to know that melatonin can be helpful as well. So that's it for my vestibular migraine supplements that I wanted to touch on. I just wanted to touch on a couple more things specifically for neuritis and Meniere's disease. I got this off of the Vita website. They talked about L-lysine, which is an amino acid. It's important in making proteins in our body, and it can be helpful for tinnitus and vertigo decrease. Some people swear by it. Some people say it doesn't help because it is naturally occurring. It can be a good one to take since we produce it anyway. And some people, like I said, swear by it. Be sure to ask your doctor. And then ginkgo biloba, which I know almost nothing about. It was just on there. Might help with tinnitus, some people say. So because there are so many different people, so many different things everyone says they swear by, it's always good to check in with your doctor first and see what you should do about your vitamin and supplements. You can get a blood test, but most of those blood tests only test for the extracellular levels of these vitamins, so the things are outside of your cells. But what you actually need to learn is what's inside of your cells, so what's helping create energy and things like that. And because that's a really expensive and difficult test to come by, not really worth it. Sometimes it's just worth it to supplement it and see what happens if it's a safe track for you. So I did have a couple questions. Most of the questions that I got a lot of them this week, but most of the questions were what supplements are best. And so we just went through those. So that's great. We're done with that. But someone specifically wanted to know, a bunch of other people wanted to know this other question, so I'm just going to quickly run through them, and then I'm going to log off for the day. So someone first wanted to know about magnesium for BPPV. Is that helpful? So we talked about that a little bit. I said calcium and vitamin D3 are the ones that have good research and science that backs them. Magnesium, not so much. However, if you are a person with chronic BPPV because of vestibular migraine, and that is the reason you keep getting BPPV, then it would be good to take magnesium to treat the migraine, to treat ultimately the BPPV from recurring. Someone wants to know if vestibular rehab can help decrease imbalance forever if you do your exercises? Yes. If you're having recurrent attacks of vertigo or vestibular dysfunction, then your vestibular system might have a little bit of a setback, but you can do your exercises again and those symptoms should go away. So it's good to know that, yes, the vestibular system is really sensitive. And so not only does that mean it can be sensitive in a negative way, but it can also be really sensitive in order to it can also be helpful, obviously, or else people wouldn't do it. I kind of compare VRT to like an ACL repair. So everyone knows someone who has an ACL repair, and then all of a sudden your quad, which is the top muscle on your thigh, is really, really weak. So it's for the rest of your life, a person with an ACL injury should probably do extra quad exercises on that side. A person with a vestibular injury, you're probably going to want to do vestibular exercises, balance exercises, etc. for the rest of your life. It's just a good idea. People really want to know about caffeine. I said we touch on this. So caffeine, I do believe, is a vestibular migraine. It can be really causative for those things, I guess I should say. So because it's a stimulant, and someone left a really excellent comment on the picture I posted yesterday, if you want to go look at that after this, but I'm going to kind of reiterate what they said. So it's a stimulant, and it will increase dopamine fluctuation production in your brain. Your brain gets a really quick hit, and you're like, oh, I'm really happy now, but then it can also trigger a migraine because your brain really craves predictability and the sameness all the time. So if you're not having a constant amount of dopamine in your brain, then that's where the problem comes in. So that's how come it can be a trigger. And I do think that people who have vestibular disorders should avoid caffeine. It's just what I've seen in practice. Anecdotally, there is research to back it up. People with vestibular disorders just happen to be more sensitive to caffeine, even when compared to people with regular migraine. Someone's saying right now, Mrs. Migraine-tastic, she's great. I never realized how much caffeine was ramping up my symptoms until I gave it up for 18 months ago. Gave it up and now only feeling it. So I just gave up caffeine. I don't have vestibular disorder. I just gave it up for other health reasons. It's hard to do. You will get a headache at first. So like you said, ramp down really slowly. There's a post quite a bit back by a dietitian that I partnered with. And we talked a little bit about how to ramp down. So you do like regular coffee, and then you put like 1 scoop of decaf and 3 scoops of regular, and then like keep decreasing until you get to total decaf. People with vestibular disorders should only be drinking Swiss water processed decaf coffee, not regular decaf coffee, because it still has caffeine in it if it's regular decaf. Someone wants to know why they're movement sensitive. Your vestibular system is the system that senses movement. You have 3 of them. You have your balance system. You have your proprioceptive system, so the way your skin and joints feel where you are in space. You have your visual system, the way we can predict what's in front of us, see our surroundings, and then our vestibular system, our inner ear, acceleration, deceleration, spatial awareness, movement in general. So every time you move your head or your body moves, that you feel like you're moving because of a combination of those 3 things. If your vestibular system isn't sending the right signals, then you're not getting all 3 together. So that is why you're movement sensitive. It is because your movement system isn't working 100%, and VRT is here to fix that. Someone wants to know if if you don't have vertigo, can you still have VM? Yes. Having true room spinning or body motion vertigo is not a criteria that you have to meet in order to have a VM diagnosis. If you want to see the criteria, you can either Google them or you can go to my website, find the article about vestibular migraine, and the criteria are listed there. Please wean off sugar or caffeine. Do it slowly. Yes. And reduce over time, let your body catch up. Yes, if your body is used to something, thank you, Mrs. Migraine-tastic, she is the best. So if you're going to reduce anything in your diet, I do not recommend doing anything cold turkey. I just don't think it's a good idea. Your body will go through shock. You'll not know what's helping and what's hurting, what are symptoms that are normal and symptoms that are old for you, symptoms that are new for you. So do all of it slowly. So if you're having a really high sugar diet, just start by adding more vegetables in, adding more fruits in, adding more whole foods in, rather than just like cutting everything out cold turkey. So definitely my recommendation as well. Sugar can be a cause of vertigo for some people, especially if you have vestibular or Meniere's disease, some people with vestibular migraine as well. All right, you guys, I have to go see patients. Sorry, I double booked myself this morning. I don't usually see patients till 10, but today I'm seeing one at 9. So I will see you guys later. You can always, there's still a question sticker up. If you want to ask me more questions, I can try and answer more later. Lastly, if anyone has any tips for things they do in social situations, there's a question sticker also on my story. To answer that question, I'm going to kind of throw something together. Alrighty. Have a good rest of your day, guys. Bye.